Here, Sameera, what do you have to say for this Yosemite and Rhine studies?
Good morning, all.
Mike.
Good morning, all. Thanks for this opportunity. There is nil financial disclosure. I shall be talking on phase 3 clinical trial of faricimab in diabetic macular edema, which was published in Lancet in February 2022. What happened? It's coming. The study purpose was to evaluate the efficacy, safety, pharmacokinetics, and durability of intravitreal faricimab 6 mg for the treatment of diabetic macular edema when dosed either every 8 weeks or according to a PTR regimen in adjustable intervals up to 16 weeks compared with intravitreal aflibercept 2 mg dosed every 8 weeks. And these two studies were identically designed, double-masked, multi-center, randomized, parallel group registrational phase 3 studies. These two studies were conducted across US, Europe, Asia, and North America. The study enrollment started in September 2018 and it ended in August 2021. Adults aged 18 years or older with center involving macular edema secondary to type 1 and type 2 diabetes mellitus were included in the study. Can you use this? Oh, this is happening.
Audio-visual issue. So, any comment from any
from the audience? We'll take one comment. Yeah.
Nobody. Because
They are just observing very keenly.
Yes,
like
carry on.
Between India and Pakistan. Right? From 2 o'clock, it's going to start.
1 eye per patient with best corrected visual acuity between 2040 to 2320 was included in the study. Central subfield thickness 325 micron or more was one of the inclusion criteria. Any VGF treatment naive or previously treated eye, both were actually included in the study. The previously treated study eyes numbers were limited to 25% of total enrollment. And all these patients were randomly assigned 1:1:1 into 3 treatment arms. The first treatment arm was intravitreal faricimab 6 mg every 8 weeks. In this arm, all patients received 6 injections of 6 mg faricimab initially as loading dose, and then they received 6 mg faricimab every 8 weeks. The second treatment arm received first 4 monthly injections of faricimab 6 mg, and then faricimab injection was decided based on personalized treatment interval regimen. In this, the extent of injection interval was up to 16 weeks, depending on the case scenario. The third arm of the trial received monthly intravitreal injections of 2 mg of aflibercept for 5 injections, and then aflibercept was injected at 8 weeks interval to maintain the masking. All these patients were being called to the clinic every month, and the investigations also were done every month, and when there is no injection to be scheduled, then they got SAM injection. Patients in the faricimab PTI arms followed a treat and extend-based personalized dosing regimen using a protocol-driven algorithm based on changes in CST and BCVA. During the initial phase, patients received monthly faricimab injection until they achieved central subfield thickness less than 320 micron at or after 12 weeks. And once this was achieved, then the next injection was decided as per the protocol, that is PTI, based on its central subfield thickness and best corrected visual acuity.
Can we have a permanent solution for this? वो बार-बार उसको आप press करते हैं.
Yes.
So there's no permanent solution. What Monica was saying, but same happens with anti-VEGF also. There's no permanent. People keep coming. Audiovisual people are coming every 4 minutes.
Yes, sir.
So just to make this discussion more exciting, I think all of us are waiting for the launch although we have this data available now, all of us are very eagerly waiting that when will it be available. Anybody from Roche is here? Roche का कोई है?
रोश का है ना वो रेणुका
People are busy. Roche, you are there from Roche.
yeah
So when it is likely to come, madam?
Now, please come on to the dais and take this microphone and speak.
The question is that all of us are eagerly waiting. So when it is likely that first injection of VABYSMO will be injected in India?
Sir, mostly we are
Mike.
launching in VRSA, sir.
You tell the
VRS.
date, na? We are asking the date.
Date is not yet released, sir.
Month?
First week of December, yeah.
First week of
December.
December it will be launched. And any idea about the costing?
Unofficially, it is 88,000. I'm taking her quote as this thing, and it will be 1+1 offer will be there. So it is like 44 to 45,000 per injection.
Just a minute.
Provided the
minute,
company,
minute.
whatever it promised, like 16 weeks if it happens, really I will be very happy. And I'm hopeful because
So
it is
Ajit
a
Babu,
dual action.
Ajit Babu, are you going to shift all your patients? Are
If
you going
it
to
is-
shift, yes or no?
If it is 16 weeks, majority will be shifted. Not me, but they will ask.
Yeah. Are you ready, Sameera?
Renuka, if anybody from the science side is there in Roche, can you tell us if it is more viscous and whether the injection needle gauge has to be
Yeah, the
changed?
viscosity of the injection.
Because
and the,
we understand that it is more viscous, it takes more
gauze,
time to prepare.
injection gauze of the injection.
So can somebody tell us what is the wider
Any
gauge needle
medical
required?
you can call them and tell them.
Somebody is there from Roche?
Medical person is there
I have heard is that it's slightly difficult to inject. So is 30 gauge needle the more, is the appropriate needle, or you are going to have 29 or maybe? So inject किससे करेंगे? Inject किससे करेंगे? वो तो filter तो ठीक है.
Usually 30 gauge only.
You see, I for one
it is
know, I for
30.
one know that this they haven't got DCGI ka final clearance, and for last 2-3 months it is stuck. And initially Roche had promised that they will do it in October, November, December now. So I use your might, whatever, to get this clearance as fast as possible, because otherwise this excitement, is in everybody's mind. Because RCTs are something else, but real world scenario is what you are waiting for. And believe me, the day it comes, people are going to inject and see, and then we will have huge number of presentations. It works nicely, it does not work, whatever. So that is what is important.
It's mainly the post hoc analysis.
Yes, Sameera.
Especially after the RCT in the clinic, how it is working is more important than anything else.
Yes, madam.
Yes. The primary endpoint was to evaluate the efficacy of intravitreal injection of faricimab 6 mg on best-corrected visual outcomes as measured by change from baseline in BCVA at 1 year, determined as the average change in BCVA from baseline at week 48, 52, 56. It's not moving. So there are several secondary endpoints. I'll discuss this in the results section. It's not moving. This one?
Yes, ma'am.
Okay. So there are total 1,532 patients were screened, and out of which 940 patients were enrolled for the study. And there were some dropouts during COVID time, and finally 282, 283, and 285 patients remained at the end of the study who were taking treatment. But for analysis, they have considered intention to treat, and they have taken 315, 313, and 312 patients in the first trial. And in Rhine, total 1,715 patients were screened for the study, out of which 951 were enrolled. And for analysis, 317, 319, and 315 patients were considered as per the intention to treat analysis in all these three arms respectively. Baseline characters of three groups in each study are comparable. In this study, primary endpoint at 1 year was achieved with an average of 10 to 11 letters gained, which was maintained to year 2 in all treatment arms. These mean vision gain were comparable for all treatment arms. This was achieved with faricimab PTI arm having fewer median injections versus aflibercept, that is 11 versus 14 respectively. In addition to vision gain, faricimab demonstrated greater mean reduction in CST versus aflibercept at 1 year, which was maintained through year 2, and this was achieved with faricimab PTI arm having fewer median injections versus aflibercept, 11 versus 14. In post-hoc analysis, first absence of DME was achieved faster and in more patients treated with faricimab versus aflibercept. Absence of DME, which was 75% achieved at week 20 in faricimab groups with average 4.8 or 4.2 injections. In aflibercept group, this was achieved at week 36 after an average of 6.7 injection. Again, in a post-hoc analysis, first absence of intraretinal fluid was achieved faster and in more patients treated with faricimab versus aflibercept. This time point at which the cumulative incidence of absence of DME reached 50% was week 48 in faricimab after an average of 8.4 or 7.5 injections respectively. In aflibercept arm, the 50th percentile was reached at week 84 after an average of 11.7 injections. There was greater reduction in macular leakage area with faricimab. More faricimab patients had resolution of macular leakage. And in faricimab PTI arm at 1 year, more than 70% of patients achieved extended interval of 12 or 16-week interval dosing with faricimab, which increased to 80% at second year, by second year. The proportion of patients on 16-week interval dosing increased from 52% to 52% at week 52 to 60% at week 96. Faricimab was well tolerated with an acceptable safety profile. Rate of intraocular inflammation was low and comparable between treatment arms in DME. No cases of retinal vasculitis or intraocular inflammation due to retinal occlusive vasculitis was noted. In summary, faricimab PTI arm demonstrated durable efficiency and safety for DME over 2 years. Comparable vision gain with fewer injections, improved and rapid decrease in CST, and So there are a couple of other reports coming off related to faricimab, not related to this study. One such report is resolution of hyperreflective foci in DME. Faricimab reduced hyperreflective foci volumes significantly as compared to aflibercept. And faricimab reduced hyperreflective foci in outer retina as well as inner retina as compared to aflibercept. The second report coming off is effect of faricimab on epiretinal membrane formation. Through week 100, faricimab led to 52% reduction in the risk of epiretinal membrane formation. Thank you.
Thank you, Sameera, for highlighting the usage of faricimab in UZIMITE and RHINE trials. I think by and large, similar figures as Tanaya and Lucerne about the efficacy, about the durability. So I still, will conclude by saying that drug is promising. There's a lot of excitement in the air. All of us are waiting, and I just wanted to know if anybody knows what percentage of patients in West or USA have shifted from, say, aflibercept or Eccentrix or ranibizumab to faricimab, because they will definitely have more experience in this. And I will request Roche people, whenever we have session like these, we should have one person online maybe in the beginning to tell his or her experience. You see, as of today, we are talking theory. All of us are waiting, as I said, for December launch here. And if we have some data, anybody from Roche?
This trial has included both treatment-naive patients as well as already treated patients. And in already treated group, they had already received other anti-VEGF injection, but number of patients, already treated patients, they have kept to 25% of the total enrollment.
Let us just summarize now, because it's the end of the session. As we already discussed, that in these trials, we have only trial data is that we can extend to Q12 in over 80% of the patients, and to Q16 in about 50% to 60% of the patients, which if you compare with trials for aflibercept comes to 60% of the patients can be extended to Q12 and 40% to Q16. So there is about a 20% difference in the two drugs, that is. Now these are RCTs. In reality, when we actually work, the results are very different. We have many patients with aflibercept who are going to 6 months, 4 months, easily, even 10 months. So even with this new drug, now we have to see whether those patients who are not responding well enough to aflibercept, who require Q12 or Q8 injections, whether they can be extended. So there is going to be a small proportion of patients, possibly 10% or more, which may require this drug, which are not responding well enough to aflibercept.
So let us conclude this session by saying that we are waiting for this 20% advantage. 20% advantage, as Malika said, is, I think, for me, good enough to force me to shift a lot of my patients from existing molecules to faricimab. So with this, I thank all the speakers as well as moderators here, and thank the Roche company for helping us conduct this wonderful session. Any last comments?
Probably next year we will come with more experience regarding the duration of effectiveness of the drug.
So
Thank
one,
you all.
one.
We will thank all the people and all the audience mainly in large number they were. You want to say something?
Yeah,
please.
they have measured the level of VEGF and angiopoietin level in aqueous as well as in vitreous in few samples, few patients, and they have shown that this is working beyond 4 weeks, and 8 weeks also it is very significant.
No, I am very optimistic. Means even if it works for 20 weeks, I will be very happy. But skepticism always prevails.
It's an exciting drug, looks
yeah.
like. I think, but we should not go by the face value only. We need to wait and
We should
have
always
it.
wait for the
I
clinical,
agree.
our
I agree.
Exactly.
The thing is that real world has to
Yes.
ultimately
Exactly.
be
Yes.
the
I
king.
think that's more important than
That
anything.
will be the king that, like Ajit Babu said,
I'm
next
with
year,
the audience.
Yes,
next year
If they use, it should last for longer.
correct.
Yes. Okay. Next year.